Today with our group we had a great experience with robotics. We saw different cases, we saw primary simple cases but also complex cases. So I think all the aspects of how to use robotics were shown to us.
My experience before today was that I didn't see it. The experience of today was that we saw different cases, a different kind of robotic surgery in the knee and the hip. It was very nice to be here, and we saw many positive sides of using the robot for knee or hip replacement.
Before today I didn't have any experience with the robotic surgery and I saw a uni and a total knee replacement, and I found it very interesting how it worked and how it worked out for the patient.
We had a great, fantastic day today. First of all, I would like to thank Dr. Perazzini and his team for showing us here the robot surgery, and we had a great time. We did 2 primary hip replacements, and it was really enjoyable and nice to see how the robot surgery works.
I didn't have any experience in the recent history with robotic surgery, so this was my first contact with the MAKO robot arm, and it was really interesting to see how especially the partial knee replacement was performed, and it was really challenging to do a cut of the tibia without looking at the patient but looking at the computer screen.
The advantage for the surgeon is that the robot helps you to guide the prosthesis precisely as you have planned it. The advantage for the patient is that the prosthesis is placed as good as possible, and by that I think we have more satisfaction in the patient on the long term.
I think with this robot surgery we get optimal placement of the components, and I think that's the better workout for the patients in the long run.
Robot surgery can be very helpful, I guess, in easy primary hip osteoarthritis, but also in very difficult cases. And I'm looking forward to try this also at home in the Netherlands. I think this is the future and it will help us.
I think there are a lot of advantages, but for me the thing I saw today was that in a complex case where you have a changed anatomy, that the robot can really guide you to place your components in the right way, and also to make it more reproducible.
I think the advantages for the surgeon and the patients are especially for the surgeons, are the reproducibility of the steps and to restore a leg alignment, especially in partial knee replacement.
In the future, yes. I don't know when that future is starting, if it's in 1 year or 10 or 20 years, but I think it will become more and more robotic surgery.
We don't use it yet, but we are looking to it, and I hope that in the coming years we can also try and work with the robot surgery.
I think this is the future, so probably will show up in the Netherlands in a couple of years in any hospital.
I think robotic surgery has quite a big future in orthopedic surgery. Not in the coming years maybe, but in the further future I think it will be a big thing in orthopedic surgery, yes.
I think it's the future of orthopedic surgery, of the joint replacements. So it's not a question if but when. And at this point there are only 3 MAKO systems in the Netherlands, but I think that amount will grow, and I really hope that we will be able to use robotics also in our hospital.